And welcome to my Facebook Live. My name is Ed Cardinal, and tonight you're going to learn a little bit more about your prostate gland. And for you men, it's important information to have. The prostate gland is located just below the bladder and in front of the rectum, and it's normally the size of a walnut, the size and the shape of a walnut. But as we get older, and it's almost inevitable, in fact, 8 out of 10 men, as they get older, their prostate will become enlarged. It partially surrounds the urethra, so that the urethra is the tube where the urine flows from the bladder and out the body. And if the prostate gets enlarged, it can squeeze that tube, and then it can inhibit or affect the flow of urine. And that's called, as it gets enlarged as we get older, that's called benign prostatic hyperplasia, or BPH. They say that 8 out of 10 men, as they get older, will experience this. Men over the age of 85 years old, 90% of them will have BPH. And 30% of men will have symptoms that will create some sort of discomfort or become bothersome. So what are the symptoms of BPH? Well, I'm going to give you 3. One is that the bladder doesn't empty completely, or the urine flow starts and stops, or that you have to strain to get any flow going. So those are 3 symptoms of BPH. And the first word, benign, means it's non-cancerous. So the treatments for me, and this is something that I experienced about 50 years old, where my urine flow started to change, and I had to educate myself about what that meant. It was a little worrisome at first, but then as I learned what it was, then I knew what steps I could take to help shrink it down. And what the route I went was herbal. I use a concentrated herbal blend, and one of the ingredients that's important to have in any sort of herbal for BPH is saw palmetto. Other men might choose medication, or even, if it gets bad enough, surgery. One of the things that's also important for you as a man is to get regular checkups. I've been going to a yearly physical exam since I was in my 20s. I don't know why I chose to do that, but I felt like it was important for me to do, and it's good to have that baseline. Particularly men, as we get over the age of 50, you're at more risk of prostate cancer. So the blood work, they'll check the PSA levels, and if they're higher than a certain level, it's usually 4, but that can be very variable. Then there might be an indicator of prostate cancer. And then there's also an exam that the physician will do to check the size and the shape of the prostate gland. So what are some things you can do to help prevent prostate cancer? I'll give you 3. One is a good diet. And they recommend a diet that limits your milk products, and as close to as nature intended to. So fruits and vegetables, some good quality protein. The other is maintaining a healthy weight, and that's going to be also helpful through your diet. And then number 3 is exercise. So with those 2, trying to exercise at least 30 minutes a day, most days of the week, so 5 to 6 days a week, will be helpful in preventing prostate cancer. So men, get your yearly physical exam. It is so important, not only for prostate cancer, but also getting your blood work for your heart, also testicular cancer checks, which you do on your own, But very important to make sure that you take care of yourself and prevent any sort of diseases before they happen. And it's very easy to do so by, again, watching your weight, watching what you eat, and exercising. Hope this was helpful, and if it was, please like below, and look forward to seeing you throughout the week. Take care. Have a great night. Bye-bye.